Hi guys, welcome to my channel. My name is Rosie and today is my first kind of sit down video. Today I wanted to start the first video of a little series I'm going to do, which is going to be about mental health and well-being, psychology, that kind of thing. Today I'm going to be starting off with a video which is like a kind of quick Q&A, a bit about mental health and a bit about specifically working in mental health. I'm currently studying psychology at university. I have done 2 years and currently I'm doing a placement kind of year out, and during which I have spent time working in 2 different places, 2 different mental health kind of inpatient settings. One was a rehab and the one I'm in now is a PQ ward for women, and PQ stands for Psychiatric Intensive Care Unit. So if you think about an intensive care unit for general health in a hospital, it's kind of when people are in kind of dangerous scenarios with their health, they're at risk of their life. These patients are kind of high risk, and it's the same in the PQ ward that I'm on. These patients either pose a high risk to themselves or to other people. So the first question is, how important is mental health? And my answer to that is obviously very important. I think, to be honest, it is just as important as physical health. Often it obviously gets overlooked. I think if you think about that scenario of having a broken arm or a broken leg, you can kind of visibly see the damage, you can visibly see the pain that somebody's in, and instantly comes along with that the kind of sympathy and the get well soon cards and messages. Unfortunately, the difference is with mental health, if you have a mental health condition or disorder, obviously you can't see it most of the time. Sometimes there might be some kind of indications of it in terms of maybe self-harm, or I don't know, with a more patient with psychosis you can visibly see that they're responding to external stimuli. But with a lot of cases in mental illness, things like depression, anxiety, you can't really see what's going on in someone's brain, and obviously you can't really see the pain, the discomfort, all of the struggles that they're facing can't be seen. And I think that makes it quite difficult for some people to understand that somebody may be going through quite a serious, potentially life-threatening problem. Basically, it's as important as physical health. Just because you can't see it doesn't mean it's not important. So the second question I've got is from Chas. It is, how do you deal with depression? And this isn't really something I was going to cover in this video. I wanted to more talk about my experiences working on a ward. However, I can definitely make a video on it. I'm not exactly the most qualified person to talk about it. I'm not a nurse, I'm not a doctor. I could definitely do a video on some tips. If you wanted some quick ones now, I'd definitely say 1, keep as active as possible. Obviously it's very difficult when you're depressed and you're lethargic and you want to stay in bed all day. I completely understand that. But staying active definitely is something that, 1, distracts you from everything going on inside your head, 2, keeps you busy and interested in hobbies and things that you're enjoying, and it just brings a bit more enjoyment into your life. Number 2, I'd say try not to cut yourself off from friends and family. Keeping in contact with friends and family, using them as support, definitely is something that's really helpful. Number 3, I think, is quite a simple one, but just cut down on the alcohol you're drinking and keep up a healthy diet. Really simple, things like that can really affect your mood. Alcohol can be really damaging for your mental health, especially if you're suffering from mental health issues. It can be a massive trigger. And diet, just making sure you're looking after yourself, looking after your body, that kind of thing. And of course, if you are struggling, please do seek help. We'll talk a bit more about it in the video later, but seeking help from your doctor, seeking help from a therapist, things like that, really important. You deserve the help, so please get it if you need it. My next question again is from Chas, and I'm going to kind of put these 2 questions together. She asked, how do you get over someone who was toxic for you, and how do you deal with bullying? And I'm going to kind of group these together because again, I'm not really going to go into too much detail, but If you are being bullied, again, please seek help. If you're in school, report it to someone, talk to somebody. I've been in this situation and it may feel like it's going to make it worse. The teachers are there to help you and support you, and if it's in the workplace, it's the same. Report it to your manager. It's really important it gets sorted, and the teachers, the managers, they can all help you. They can move you somewhere, they can move the perpetrator somewhere else within the organisation, within the school. They can help you work things out, so report it. Secondly, use your friends and family again as a support network. A real friend, a true friend, isn't going to make you feel guilty for sharing your problems, so please speak to your friends and family and they can help you through it, whatever you're going through. My next question is from Kim. She asked, what is some of the weirdest experiences that you've been through? And to basically run through some story times. I can definitely do this in another video, but obviously I've got to be a bit careful because you want to maintain confidentiality and you don't want to give away any personal details. So again, I've got to be really careful. Some interesting experiences. Obviously, some of the patients that are quite psychotic, they come out with some quite amusing things. I mean, it's not obviously funny that somebody's going through psychosis or paranoid schizophrenia, but some of the things they come out with can be quite funny. On my first day of a job, I had a patient come up to me and she looked at me and she said, "I'm gonna slap you," and I kind of stood there like okay, like, and she just went, "You've slept with my husband." And I was like, no, I don't think so, but obviously I was kind of in that situation quite taken aback because it's my first day. I didn't know this lady, I didn't know if she was violent, I didn't know if she was going to hit me. In hindsight, this lady is lovely and I don't think she would have hit me, but this is obviously just part of her psychosis. But yeah, you do get some interesting scenarios. Kim also asked, is it scary for you? I'd say no, it's not a scary environment if you have a good understanding of mental health. I think on your first day in a new setting like this, it can be maybe a bit overwhelming, it can be a bit of a surprise sometimes. To be honest, I think if you do have a good understanding of mental health and you have a good understanding of these people, especially as you work in the job for longer and longer, you understand the patients more, you understand their triggers, you understand their behaviours. I think it's not a scary environment to be in. Obviously, if a patient is going to start being aggressive, you're very well trained with techniques to manage the situation, whether that's verbal de-escalation, trying to calm them down and resolve the situation before it escalates, but also we are trained with restraints and techniques to kind of break away from holds and physical attacks. Also, working in this environment comes with the understanding that a lot of the patients don't mean to physically harm you. I mean, obviously some do, but a lot of them perhaps might be triggered by their psychosis. I think with the understanding comes kind of a more sympathetic approach to this rather than feeling angry, scared, that kind of thing. My next question is, each person, if broke in love, must do something to forget it. I'm not 100% sure on what this one is asking, but I'll answer the best I can. Forgetting about it and moving on. Is it the best thing to do? How do you do it? And again, to answer that, it's not something I'm the most qualified to answer, but I can definitely do a video on loss, heartbreak, things like that. A lot of the patients that I work with do have relationship issues. A lot come from broken homes, poor backgrounds, foster care, domestic abuse. Relationships can cause a lot of trauma, whether it's domestic abuse, toxic relationships, poor relationships when you're young with your parents. All these things can cause a lot of trauma later on in life, and trauma can be really difficult to cope with and can definitely link into mental health problems. The next question is from Brenda, and it is, what is the most challenging thing about what you do? I think the answer for me is obviously you're used to seeing people in pain every day, you're used to kind of witnessing some horrible things like self-harm, suicide attempts, you get used to reading about people's trauma and some awful experiences they go through, but I think there is some that do hit quite hard still when you're reading through people's notes and you see something like a patient who's been gang raped or a patient who has witnessed murder, all things like that. obviously with details is just really difficult. It's just really horrible and it does hit you quite hard sometimes. I think another thing which is really difficult, especially working on the PQ ward, is again you see suicide attempts every day in some cases, but it doesn't mean it's particularly easy. Walking on a patient and seeing them tying something around their neck or tying their clothes around their neck or trying to hang themselves, obviously it's just horrible. Nobody wants to witness it, but then again, that's our job. We're there to keep these patients safe and to look after them the best we can, so doesn't mean it's not challenging though. It's obviously really difficult and a horrible thing to have to witness. So the next question is, have any of the patients ever hurt you? Sometimes a patient will scratch you, bite you, spit on you, get you around the neck, all these things. I've seen people be punched, hit, kicked. Obviously it does happen. We're all equipped with these little alarms, so if a patient does start getting angry or violent, you can't really verbally de-escalate the situation. You pull your alarm, you call for help, and unfortunately if the patient is very aggressive, they do get restrained, so this helps them to stop hurting themselves and other people. Obviously restraining isn't something that anyone wants to do to anybody, but if they are at risk of really hurting themselves or others, then you have to step in and manage the situation the best you can. The next question is from Shatika, and she asks, why did you get into this type of work? And I think it started off when I was in school and I was studying my A-levels and I did psychology, and I really enjoyed psychology. I did that for a couple of years, I did really well in it, and I kind of thought, you know what, I want to pursue a career in mental health. So I went on to university studying psychology, and that's kind of how it happened. It's all kind of things that interest me. I love to help other people. It's a really important job, it's a really important field. So yeah, I have some experiences myself, which again I can do another video on. The next question is from Caitlin, and it's, did a lot of your patients have addictions before their admission? And the answer is, quite a few do, yeah. Things like drugs and alcohol have a massive impact on your mental health, as I said before. I've seen patients who have drug-induced psychosis, which is just an awful thing. Obviously we do the best we can to help them stay away from drugs and alcohol, but obviously when they're on leave, if they have leave, when they go home to their parents, their families, their friends, some do partake in drug use and drink alcohol, and we can't stop them once they're off the ward. It is difficult. But yeah, drugs and alcohol, really big triggers, and they do have massive effects on your mental health, so you do have to be really careful. So please look after yourselves. The next question is from Carrie, and it is, what are some helpful ways to get involved and to raise awareness of mental health? And to that I'd say it's really simple things like talk about it, talk about your own mental health, talk to your friends and their family about theirs. Just simple questions like, are you okay? You seem upset, how can I help? Can I do something to distract? Do you want to go out for a walk? You know, anything like that. Simple things like that. Keep the conversation going. Another thing is get involved, do some volunteering, raise some money. If you're interested, pursue a career in it. It's all really helpful things. But yeah, the most obvious thing is keep the conversation going, keep talking about it, and naturally you are raising awareness. The next question is from Court, and it is, how do you maintain your own mental health whilst working in your profession? And we are quite lucky. We are quite lucky that we have a lot of tools available to us. So we have access to counselling, things like that. So if you are affected, obviously you can talk to somebody. A lot of my colleagues are really helpful, really supportive, and if you're affected by something, you can talk to them. But as I said before, you should really utilise your friends and family, and if you are struggling, you can talk to them, obviously keeping confidentiality in mind of the patient. But yeah, talking to friends and family, being open, being honest, keeping the conversation going, really helpful for yourself. When I go home, I tend to really relax, enjoy my days off, do things that I love to do, see friends, see family. Obviously with lockdown at the minute, it's a bit limited what you can do, but I like to do things like play the piano, exercise, cook, watch YouTube, just try and zone out, relax, and leave work in work, if you see what I mean, not trying to dwell on things that are on your mind. The next question is from Velo, and is you with man? I mean, I specifically asked for questions about mental health, so cheers for that one, and the answer is yes, I do have a boyfriend, so cheers. The next question is from Kaylee, and it is thoughts on therapy. And my thoughts are, it's great, it's good. If you have access to therapy, give it a go. If you feel like you need to talk to somebody, please do. Obviously, I'm going to leave some links down below in the description. And I'm not 100% sure on how everything works in the US, but I know in the UK, all you have to do is walk into a GP surgery, talk to them about your mental state, tell them you need help, talk to them, tell them that you'd like to receive some therapy and you'd like to talk to somebody, and they will give you the appropriate resources, whether it's counselling, talking therapy, CBT, things like that. They will point you in the right direction. There are also some great websites that you can access and some good phone numbers, things like Childline, Samaritans. I'll leave all the numbers and links in the description. If you need to talk to somebody, there's so many resources out there, so please do get involved. Bottom line is, talk to people. Therapy is great. And the last question is a really interesting one. It's from Karina, and do you think that some people don't belong there? And I think the answer is probably no. I don't really tend to think that. I think when I was working in the rehab ward, there are definitely some patients that were more well than others. There were some patients that were definitely ready to move on. Some patients would be actively out in the community, trying to get back into work, back into volunteering. Those patients were kind of looking to move on, and we were looking to support them to find appropriate accommodation, whether that's supported accommodation or a placement for them to live by themselves, independently. And yeah, I wouldn't say those patients didn't belong there, because we were really helping them to kind of cope with transitioning and moving on from mental health services and back into the community. However, those patients were definitely ones that were ready to move on. However, in a PQ ward where the patients are all pretty much high risk, I'd say they definitely do need to be there. It is all very safe there. They don't really have anything to hurt themselves with or to try and hurt themselves with. We try and remove all risks like that, and patients that are there because they're at risk of hurting themselves, they are very safe there. And if they were to be in the community, back at home, there'd be a lot of risks. And the patients that are very violent and aggressive and at risk of hurting other people, again, having them out in the community where they have access to all kinds of things like weapons, where they can't be observed, and we can't help them to engage in therapeutic activities and, you know, access to psychology, it wouldn't be great. So these patients, I think, definitely are in the best place where they are with us. Obviously patients do move on from us and they tend to go back into other inpatient facilities, but more kind of slightly less secure and places where they have a bit more independence and freedom with less restrictions. So that's it, that's all the questions I got. There were a couple that I didn't read just because I think I'm gonna include them in another future video. If you want me to make a part 2, please do let me know and I can definitely consider doing a part 2. Look out for my future videos. I'm gonna make like a little series of this. When I make the future videos, I'm gonna put them in a little banner up there, and at the end I will include them here. Thanks for watching and I will see you soon.